All right. We're at 10:02, so we're going to get started. Good morning, everyone. My name is John Michalizek at GoldenCare, and we're going to be going over Medicare Center and how that can be of benefit to you in the next coming weeks as we get into Friday, being able to show plan presentations legally to clients and go from there. We do have chat function open. You can answer questions as we go. Everyone will be muted as we go along, just to keep things quiet on the line to reduce distractions and things like that. So feel free to ask any questions as we go, and I will get to those as best I can. I'm going to try and keep this to an hour if I can. There's a lot of information that we're going to go over. This isn't going to be a vague overview. It is going to be a very in-depth aspect of Medicare Center and what it can do for you. So as we get going, again, feel free to ask any questions. So if you haven't been there already, and if you have multiple screens, you can go along with me in doing this. Just go to Medicare.com and it will pop open this homepage here that you see here. If you haven't registered or if you haven't had the opportunity to do that, again, Medicare Center is free to any contracted agents of GoldenCare or any integrity marketing partnered company that matter. So excuse me for a sec. Quickly register. All you need is your NPN number, contact information, and you're good to go. And it'll verify that you're a contracted agent as we go. So logging in, again, only going to ask for your account number and a specific password for you guys. And here is the home page. You have your Medicare Advantage PDP. This is where Medicare app and Medicare Link are located. We're going to go over that. Medicare Supplement. This is just going to open up a real different window real quick. This is a CSG aspect, and it's a little bit different portal. I'm not going to go over this today. There's, again, as you can see, there's a lot of different things in here. This will be completely separate. I'm happy to do this again on an individual basis to show you how all of this stuff works for you from CSG. Then you have a client management so CRM, so that way you can utilize this. In the near future, this CRM will speak with Medicare app, hopefully Medicare Link too, but again, two separate entities, but it will do that. So if you want to import all of your clients into the CRM, you can do that. Simply uploading a template. It has to be in a CSV, it can't be a PDF or a Excel spreadsheet, but it has to be a CVS, and there's a way to save that file from an Excel to a CVS extremely easily. So you can do that, make it easier on yourself. We're gonna barely touch on this as we go, but for the most part, we are just going to stick with Medicare Link and Medicare app. There are also some learning tools down below that you can look at, some different sales tips if you're new to sales, tech guides on how you can utilize aspect like this. We're doing a video conference, utilizing things by phone, working remote that we've all done over the past 2 years. Carrier guides that go directly to the carrier information for each plans and other things as well. So feel free to take a look at that right now. There's also a new video right here that you can watch that's going to have new features that are available. This is a few weeks old, so it's not completely up to date, but you can watch that at your own leisure as we go. So I'm going to do this a little bit differently than I did the last time. We're going to start with Medicare Link as we go, and then we're getting into Medicare app. Medicare app has more of the functions that you are going to be looking at. Medicare Link is a little bit different tool that I like to use for more quoting aspect than Medicare app. So there's going to be a lot of detail in the Medicare app, but we're going to jump into Medicare Link and show you what that is. Again, the two are different platforms. They don't talk with each other. One's through Sunfire and the other one is through Integrity Marketing through Medicare Center. So when you're logging into Medicare Link, you have everything up here, your profile up here as you log in. You can have your list of contacts that are all here. You can look at them a little bit differently. This is where Medicare Link is going to be a little bit better, where you can see all of your contacts, say over the past 30 days. Again, I just have mine there, but you can also view all of your older contacts, searching for anything there or anything that you have listed up here. Now, I've deleted, or some of these are old on here, but I just use them time and time again. So nice thing with Medicare Link, it is a much broader viewing aspect, in my opinion, than Medicare app. So it's a much wider screen to see things. And when you have your clients, it's easy to create a client, and I'll get over that in a little bit, but you know, the different things you can look at. You can start a quote, send them your personal URL if you have that one already, and do scope of appointments all with a couple clicks to the buttons. The same thing up here, sending a scope, quote and enroll, searching different contacts based on that. All of these things up here are also the same things that are right here. The one thing to pay attention to down here a little bit are this bell with notifications. That's going to be important when you start to send scope of appointments, so that way, because as an agent you do have to sign that as well. So getting into that, if we're going to go through contacts, and I'll just utilize this one here, and we're going to get into quickly the scope of appointment process with this. So that one's already done. Let's just start a new one. Go home. We're going to create a new contact. And again, I'm just going to put my information. Oops, I'm going to change this though. Change that. Change that. Date of birth is optional. Obviously, the only thing you need to have in there is the name, first and last name. But the more contact information you have, the better. Okay, excuse me for one moment here. Okay, never mind. My phone's ringing, but obviously my do not disturb isn't working. So as we go here, now what we can do is just save that contact information. And there's all your contact information that you have there. You can add any notes into this if you want to put in, you know, if this person called in, if they emailed you in, if they sent you a direct message on Facebook, if you're utilizing that, you can use all that information there. Okay, so now we're going to get into here. We're going to actually get into the quote. So you can just click on that real quick. But now we're going to build that customer's profile information. The more information you have, the lot easier it is to go forward. So put in my zip code here, where I live, anything that you want to discuss with this, MAPD, PDP, MedSup, whatever you want to put in there. Do they take any prescriptions? Yes or no. Anything else they want to do as far as what's important to them. You know, you can have a ranking system for what's important to them going from there, depending on how you want to rank that stuff. Any specific doctors, you can skip to the plan to find a doctor, but if not, it's not a big deal. Are they currently enrolled in Medicare Advantage or PDP? No. Current type, again, this might be someone who's just aging in, so you're going to be under other, more than likely if they have group coverage. But if they have other coverage, you want to make sure that you're going to put in these notes. Again, these are just notes for yourself on that. And then again, you want to make sure that this is checked for required disclosures. It doesn't affect plan premium. It's just about calculate costs and things like that, just so you're of the aware of what's happening here. And do they receive extra help or not? Go ahead, hit no. So I'm just going to go back. Maybe hit no here. Okay, and then we're going to view all our plans. Okay. Now again, with this, I don't have everything up here on the profile complete because there's no current plan, there's no medications, no doctors, unknown frequency as far as how they go to the doctor. So baseline on total cost, it's going to be able to get changed on that. So you're going to have a big red banner up here. Completely up to you. If you don't want to see that, just click on that X there, but you can add information in on the customer profile as you go at any time. So I'm just going to close that because it's a little bit distracting. So initially when you come in here, what's available for you to see, to compare plans, to enroll plans, not everything is available to enroll in, but to compare is what you are contracted with. There was a way to sidestep that, but as you can see, all the plans that are available to me as an agent here especially on the left-hand side, Aetna, Health Partners, Humana, Medica is on there. I'll show you that in just a minute. UCare, United Healthcare, and I do have other appointments as well. They just don't necessarily all show up in here, but all these plans are available right here. Okay, you can just see them there. Now, why isn't Medica showing up, but it does show up on this side here? Well, because there's a little bit of a, well, we'll call it a file upload issue right now that we can't get Medica on here. But as you can see in the left-hand side, these are only my appointed plans with the carriers that I'm appointed with. But if we just unclick that, everybody comes up. Okay, Blue Cross, Humana, Allina, United Healthcare, UCare, Medica, all those plans are now available to be able to view. Of course, I do have a UCare appointment. I do have a Medica one. I can't, unfortunately, right now utilize these to enroll in, although I am appointed with those carriers. It's just a conversation that Integrity Marketing and Sunfire and all our contracted agents need to have with that. So you still can compare these plans with your clients. Unfortunately, because it says I'm not appointed, I can't utilize that as we go forward. But it's a way to see all of these plans in one. And that's a nice thing that I like about Medicare Link, because it's a very wide screen to be able to see everything in there. Okay, so if you want to go ahead and compare this, and again, when we're doing this, we need to make sure that we are sending a scope of appointment. So we need to go back a little bit to our customer profile. Dun, 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 dun. Okay, so we're gonna go back here real quick. Let's see. Need to send a scope. These up here, this is your contact profile. If you hit this little screen here, it's going to create a new contact. These are just notes up here as far as where this contact is within the process. Are they new, duplicate? Did they unfortunately decease? Are they ineligible? Yeah, you left a voicemail doing follow-up, scopes, you sent a Pearl, sent apps, things like that. So we're gonna go ahead and save that there. We're gonna go back here. Okay, so now we're gonna get to a position where we're going to be able to send a scope of appointment. Here's my new one that is down here. Actually, I should double check that. Hold on a second. Okay, so we're going to go to duplicate just so I can save that, so I know which one is which. So now we are going to go ahead and get into the scope of appointment aspect. So we go ahead and send a scope. Obviously, we need to do that beforehand. The nice thing is you can send by email and you can send it by text. Either way is good. For sake of timing, because it a little bit of security going on here at GoldenCare with emails, I'm just going to do it via text. Again, that more information that you have, the better off you're going to be able to send either by email or scope, depending on how tech savvy the person that you have. So I'm going to click on send a text. This is a generic scope of appointment. You can do standalone. We're going to go over here. By default, you can just send everything there. But again, here's your agent name, your phone number based on your profile, your beneficiary's name, their profile, address, all the stuff. The more information that you have in here, I could show you where I live. Feel free to look at on Google Earth if you want. Initial mode of contact that you need to have. Again, any asterisk item you need to have. Incoming call, agent signature. Don't worry about that right now. Plans to present during this meeting, MAPD. And the date today is 9/28/2021. Automatically populates over there. And again, this is if the scope wasn't assigned, why. So go ahead, we're going to send a quick text to that. This is a note that you're going to receive. This is a personal code that's going to expire within 2 days. If they don't receive that, and you're going to need this information as you go forward because it is a personal code just to that person. So go ahead, we're going to hit send, and I'm going to get a text, and I'll show you what that looks like when it comes through. See, look, there's my text. Close that up, text. And here's the message that you're going to receive. Okay, dear John, click on the link below to electronically sign a scope of appointment form. There's information coming from the agent that sent you that text. So we're going to go ahead and we're going to click on that link. That's going to open up a new page for us. Okay, and again, to view the scope of appointment, we need that personal code that we put in there. I just copied it over. It is, again, in that message, in that text message. It should be. Typically it's in there. Sometimes it comes in a different message, but have them write down that code when you send it to them so that way they have that, especially if they're receiving it via text. Go ahead and hit continue. And there's your scope of appointment confirmation form. Here is signature on there. If they do have power of attorney, they need to have that information there. With that, go from there. Make sure everything is good. Any disclaimers you want to read, go right ahead. We're going to go ahead and hit save. Okay, thank you for completing the scope of appointment. There's my contact information. Default phone number, of course, is not the correct one. Go from there. So now we're in here. You can see that the information on my profile here is the information there. There's the scope of appointment. There's the personal code. That's there. When they have signed that, they've gone through that. What you can do then is just hit this blue button. Go ahead. Now you can see where the personal code's disappeared, and you as the agent can go ahead and sign on that. Click on that, and it's automatically signed for you. So you can do two different things, and I'll show you this in a second, but here's a view of that signed scope of appointment for you, and that is saved on their profile. You can save this as a separate PDF if you so desire, want to print it out and put it in a hard file. If you want to do that, if you like to have everything in paper, you certainly can do that. Because as technology goes, sometimes things get old, disappear, and then you have to replace them. So sometimes it doesn't always get saved, but that way you have an idea of how of what it was. So now here we're done with that scope of appointment. Now we can go in and view our quote. So we have that. Yeah, good question, Janet. She asked, does Humana accept generic SOAs? They will, yeah. It doesn't have to be specific because a generic scope is approved by CMS. So Humana has to do what CMS says. So yes, they can. They'll accept it. If they don't, then we're going to have to deal with that. We'll take care of that for you. Good question. Okay, so now we want to be able to do quotes. And again, it automatically defaults to appointed plans only, which is just fine. I'm going to do a couple different things with that, kind of show you. But again, down here on your notification page, go click on that. Oh, it might change because I signed it already. Or not. All right, fantastic. Oh, there we go. Let's go click on here, notifications again, so you can see what this notifications is like. And it may not be functioning very well since I already did sign the scope real quick, but you can see, let's go back. Oh, I think I broke it. Just call me Wreck-It Ralph. We'll get this squared away. Okay, but again, here's the notifications of when that scope was signed by your client. It's just not working because I think I already signed it real quick right away. Okay, but now we go into here. We're going to be able to start our quote with our client. Okay. So again, with this, I'm going to unclick this just for the things, just kind of show you differences. Me as a member, I'm just gonna, I want to be able to see just 0 plans and be able to compare and quote those. So when you have the ones that are in blue that you are appointed with, when you hit quote, they come up in here, blue box highlighted. Okay, we're just gonna do this, this, and this. So when you can hit, go ahead and you can compare these. Clicking on that button, it pops open a new window where you can completely compare side by side the total out-of-pocket costs that are going to be included with each plan, every additional information that's included with this. This is essentially your summary of benefits that you're going over with that individual on the plan when they're ready to enroll. Everything is based on what the carrier provides to Sunfire. So if there's something that's not listed there, like again, more specific on these 2 plans versus this one here, again, hearing aid, $500 per year, see the EOC. Okay, pretty vague on that. But there's more information that you can hear if they want to have more details, going through everything there that's included, preventative services and whatnot. And again, see everything that's covered, original Medicare, getting down inpatient care, the drug benefits that's available to everybody on the plan. But at the bottom, you have your full summary of benefits. So when you do click on this, it does open up a PDF of the actual summary of benefit from that plan. So it is the actual summary of benefits. There's no vague details that are going to be missed on that. So just rest assured with that. Also, evidence of covered if it's been provided, and any star ratings that are available on there. Again, as a presentation, you do need to list those going forward. So that's the nice thing about doing a comparison aspect with that. So with this, again, once you're done with that, you can click and enroll. We're gonna skip that process just for now, but I want to show you what else happens with this. You can also email that to the individual. Again, don't have to have it in there. There's a specific PIN number for this quote for that person. You can go ahead and send that quote over. For timing purposes, I'm just not going to do that, but you can email them a quote from there so they can see that as well. Now, what if you are in this situation and you want to add the UCare one, but you don't want to do the Alina network? You can do that. However, if you notice at the bottom, make sure you can see that. Okay, this is grayed out down here. Okay, same if I take the ARP and I put the Medica one in there, I want to compare that $0 plan, take out the Humana one and do a different UCare plan, just a minor monthly premium. All these are now grayed out. If I want to go ahead and email that, I can't, because again, I'm not appointed with that. So unfortunately, you can't do it that way. But is there a way that you can email them a quote or a comparison? Absolutely. You can just hit compare. It still brings up that same thing that you saw before. What you then can do is right click, hit print. You're not actually going to print it out. You can then save it as a PDF, and it's a 10-page PDF, but it has all the information that you were just showing in your comparison if they want to be able to see it. there and then hit save, and you can then email that PDF to them if they can receive that via that way. So you can still do a comparison and email them a comparison of those other plans if you so desire. You just got to do a little bit of sidestepping to be able to get that done. Okay. So now if we're going to go ahead and we're done with that, you can search, make sure the preferred pharmacy is in network. You can select anyone, it pops up right away that, or you can go to advanced map search and to see any other distances away by changing this up to 50 miles, putting in the zip code, and there's I get 110 pharmacies within 50 miles for a line of network that I can get. The ones that are preferred pharmacies, again, are indicated in green stars. If they're not in network, it just won't have that. Or if it's not a preferred pharmacy, it'll have not a green star, but you can select preferred or not if you just want to skip that step. Okay. Doctors. You can just, again, I did a pharmacy search and I switched to doctors, but just on the top here by finding a doctor that's in it, what's in the system. Again, where I live in Scott County, it is in a line of network down there. So I have quite a few doctors that are in network already. But if you want to be able to change that, and again, just change the radius and enter the zip code in. And again, it's for this specific plan that I selected before. Okay. Real easy, and again, that's just by selecting one of those options. There's an advanced option there. There's doctors on the carrier site. This will redirect you to Blue Cross's actual Find a Doctor, which is kind of nice. And when you're searching for doctors, always go to the consumer-facing website. Try not to use the broker site. It's a lot easier that way. Okay. All right, so if we want to go ahead and since we're done, we want to go ahead and enroll. This is all the information that's in here that I've placed in here before. Oops, why isn't that working? Okay, got to make sure all these asterisk things are filled in. Again, the more information you have there, if I want to receive the plans electronically, you can do that. You can just click that box, which is good. Residential address required. Okay. Make sure that's all good. Is your mailing address different from your permanent address? No. Again, there's a summary of benefits you can have there. You can go ahead, hit save, because then that gets saved to the profile. And we're going to go ahead and okay, we'll do this one again. Okay, we're going to go ahead and wait. Ugh. Of course, I'm not Medicare eligible yet, but we're going to go through the process anyway. So then on the next page, this is where you're going to add Medicare information. Typically, I'd be able to go through this, but I can't get past this part because a lot of times I cheat and I use John Smith with the Medicare number, and it just, Sunfire is actually good that way, where I can't submit an application based on a fake Medicare number and everything like that, but that's how you go through. I wish I'd be able to show you how it looks as it comes through and on the profile, but unfortunately I can't get past this step because it won't accept that Medicare card because my name, obviously it's a fake ID and everything that goes with that. So fortunately, I can't show you any further on what that looks like on an enrollment. And again, as you go through here, as you can see, since we started an enrollment, there's one that's incomplete over here on the right-hand side. If you want to go ahead and resume that, again, knowing on where you are with your disposition, you know what profile, you can go ahead and click on resume enrollment. It'll take you back to the first page that you started on, verify everything that's there, and go ahead and hit continue, and you're off and running. Any questions on Medicare Link? I know I'm going through this extremely fast, and I apologize if I am going too fast with this for some people, but be happy to answer any questions if anybody has stuff on Medicare Link right now. No? Okay. All right, that is Medicare Link. And again, notice the difference. Yes, Janet, does Medicare Link allow you to input all your doctors and clients and then do the doctor search for you, or do you need to do? You can, as you can tell on the, we're gonna go back in here, especially for like Blue Cross. Oh, fantastic, 50 miles, search. I don't know why it shows Chicago. That's just probably default where Sunfire is. Wow, okay. We're gonna go back. Oh, I can't do that one, that's why. Okay. Doctor accepting patients. So when you selecting on the doctors finding patients, it'll give you everything that's relatively close to that person. But if you want to go to advanced search, this is where everything is going to be here. I wish there was a better way to answer your question, Janet, but I don't think there's a way to do all the doctors. But you would have to do one at a time per plan that you're looking at. Unfortunately, right now, there's not a way to do all the doctors at once that accept every plan. I think that's the question you're asking. Is that the same? What about pharmacy comparison on Medicare Link? Is that the same question you're asking? Is there a way to see what pharmacies are accepted on all carriers at the same time on all these plans versus that? Is that the question you're asking? Oh, yes, you can. That's based on the medications that you input for the on the profile. Because then you can save your preferred pharmacy up here, medication, going there. Unfortunately, there's no blue button with this, with Medicare Link, unlike Medicare app where you have that access to it, but you just have to individually add all of those medications in there, save, and boom, boom, boom. That'll then change all these estimated costs, annual costs, and things like that. So yeah, you have to do that for the profiles based on up here, up on the customer profile. But again, I didn't put any of that stuff in here besides my preferred pharmacy, and that's why all this stuff is orange and highlighted, because I didn't complete that in there. But that'll be, so once you have all those medications in there, it's saved for that, and that'll change based on the plan and their drug plans. Okay, good question. Any other questions on Medicare Link? Okay, all right, Medicare Link is done. We're now going to go into Medicare app. Weird thing how half an hour has already gone by. All right, Medicare app. This is going to be more of your enrollment tool that's going to be used more often than Medicare Link. It just has a different viewpoint through it, different ways to go about it, and being able to see your clientele. I just wish there was a better way to right now search different profiles, because if I hit just search profiles, I got to put information in there just to search. Raphael, yes, you do have everybody who has access to MedicareCENTER as a contracted agent through GoldenCare or in another Integrity partner company has access to Medicare Link, Medicare app, anything that's on this page here, Medicare at MedicareCENTER. That's all included. Does one profile work for both Medicare app and Medicare Link? Unfortunately, they do not, Janet. They are separate platforms. They don't talk with each other as of right now. So the one difficult thing about working with Medicare app is that you do have to do searches for profiles with that. And as I mentioned before, the CRM portion of this, the client relationship piece to this will very, very soon talk to Medicare app and being able to click on a profile and be able to go through an enrollment right from the CRM. Okay, but for now, unfortunately, we're just going to do this for time purposes. So when you're creating a profile, try and put as much information in there as possible. You don't have to worry about confirmation numbers or anything like that. This is all information just for you to go through there. So if we go ahead and search, and again, I've done this a number of different times as we go through here. So we're just going to go ahead and, you know what, I'm going to go ahead and create a new profile. This will be fun. Might as well do that because everyone needs to do this anyway. So go ahead and you're going to put the zip code that they live in. It's going to pop up what county. For time's sake, I'm just going to put all this information there as we go, making sure that you have all the correct information in there that's there. Do they have sales contact different from the beneficiary? That's if they have power of attorney. If no, go ahead and make sure you hit no there. If they have information, like they have a Medicare ID, and all that, if you can gather information, it makes it a lot easier as you're going forward. You can go ahead then hit save. Okay. And the nice thing is it doesn't open a new profile. Don't have to worry about that. And then you can get into the idea of adding preferences for that person, their health history there. You can continue to the scope of appointment, or you can continue on to their plans. So in a step-by-step process, the best way to go about this is to go ahead and add in any preferences that the client may have. So their health history. What type of plans are they interested? Do they want an MA only plan? Are they only looking for a PDP, or are they looking for an MAPD, or they don't necessarily know right now? Completely up to you on what you want to do that. When you hit any of these buttons and go ahead, besides the MA only, do they receive help from Medicaid? Do they have supplementary security income? Do they belong to an MSP or MSA through their current plan? Do they get any kind of special help? And if they don't know, you don't know, but it helps to have this information. It's not required because it says optional, but it helps to have that information going forward and doing that. You can also skip this part too. You can go in and hit next. How old are they? Are they under 65? Are they, just starting, or are they on disability? Depending on their age bracket, depends on, what their significant needs are. Do they have a specific provider? Do they want a list on here? The difference thing with this, so if I go ahead and find, anything, this is again in my area. So if I expand, this is based on a very narrow search. So if I go ahead and expand this out by using this, unfortunately you can't scroll on here. If you hit search again, it'll pop up more doctors within that mapped area. So if you need to go further north, again, for Prior Lake where I live, this is based on this area here. You got to go a little bit further out. And again, it'll go a little bit more. So now there's 30 different doctors. Now there's 80 different doctors, as you can see down here. Going down here, we're just going to go and we're going to select, add this provider. Oops. Okay. So once you select on that provider, it gives them information. You can set that as a PCP if you so desire, but you don't necessarily have to. That's just one thing, if you have a specific one, you can search by name. I'm going to go ahead and get this person out there. Or by facility if you want to see someone at St. Francis is near me. Okay, and again, you can see all the doctors where St. Francis Hospital is and their clinic in Burnsville. You can just see where everything. Oh, it's just by name. Okay, do this. Search. We're going to do by facilities. There we go. Search. All right, St. Francis Regional. You can add that provider there as well. But if you want specific doctors, clicking on that button right then and there, you can add that in there if you necessarily want someone as your PCP, and it just goes forward onto their profile. Okay, prescriptions. Here's where you can do manual prescriptions, or the nice benefit with Medicare app, it has a link to their blue button, which was new last year, I believe. If they're going to go, if you want to get all their prescription drugs and they have a mymedicare.gov profile, real simple, being able to send a quick email. I'm going to do this real quick, but I don't think it's going to pop through very quickly here. But you can just see waiting for access, and eventually it'll come through where they're going to, here's a link to log into your profile, and then you can download and have all those prescriptions there. So that's kind of the nice feature about Medicare app, is that you do have access to blue button through medicare.gov if they have a profile created with that. That's kind of a nice thing. Or you can again do stuff individually down if they don't have a very long laundry list of different prescriptions. I wish it was done by text, but unfortunately you can't. Pharmacies, oops, no pharmacies near Cleary Lake, I know that for sure. Search. Here we go. And if you want to set a default pharmacy as it's waiting, maybe. Okay. No, we're going to go ahead and skip that for now since it's taking way too long. I don't want to take up everybody's time. So once those preferences are done, then it jumps into all the plans that are available in the county area. And again, with Medicare app, if you're not aware already, Medicare app, the only plans that you're going to see are the ones that you are appointed with that are available on Medicare app. So it's a little bit different for me. The only ones that I can utilize currently are Allina, System, Humana, and United Healthcare. Again, I do have multiple appointments with other companies. They're just unfortunately not available on Medicare app right now. Is there a way to see those plans? Absolutely. Up here at the right at the top, it says you can click on add non-licensed plans, and that will make every plan available in Scott County available to you. The problem is you can only look at plan details. You can't do quotes and enrollments from here. You'd have to do that completely separately on a different enrollment platform. So unfortunately, that's just the way that works. Okay. So I'm just going to go back real quick to my profile here. Because again, we haven't done a scope of appointment yet. But as you can see on the notes, and everything that we've done thus far is an email was sent to mymedicare.gov and everything on a certain date. Okay. Now the nice thing is when you click on that profile up here, don't click on new profile, you're going to go up here, but any profile that you are currently viewing right here, you can then skip down and continue to go through your scope of appointment. Be able to have that there. Nice thing with this as well, like Medicare Link, you can send an email or text the scope of appointment, or you can upload a paper one if you necessarily need it, if you have that right in front, upload a file there. It's a way to do that. Okay, for time purposes, I'll just do the text. I'll email one just in case. But when you do this, all that pops up here is going email was sent and a text was sent. Okay, so on the text, looks a little bit different. Here was our one from before. Okay, now again, a little bit smaller language from Medicare app. Here's a link to complete your scope of appointment. They can just click on that link, phone, tablet, whatever they're necessarily doing. And again, here's all the information that we're going to talk about today. All the red asterisk ones are requirements for what they need to have in there, making sure everything is squared away. Phone number is correct. Is there a POA, yes or no? We're going to make sure to do that by clicking on that. They understand the statement of understanding, making sure they know what they're signing. Go ahead and submit that form. And again, thank you for your scope of appointment being submitted. You can now close this browser. As you can tell, it opened up, I'll close this out. It opened up a new window for that. Here's what we're going to discuss during our meeting. Make sure you have your Medicare card and any all your medications and any physicians and things like that you want to talk, so we can make sure we have that information there. Go ahead and close that. We're going to go ahead and continue to plans. I'll show you this real quick here as well. So we go back onto my profile, just to show you what this looks like real quick. Scope of appointment was sent via email and via text, so all that information is still there. You can then go ahead and continue back to plans. Let me see if this has popped up here real quick. Nope, of course not. Just check it real quick. Oh. All right. All right, again, since I did all non-licensed planned, everything is there. So you can just see that. But again, you can deselect show only plans that I can sell. Select that and it gets me down to that. All right, starting in doing quotes on Medicare app, very similar to that, what it was on Medicare Link. You just click on the one plans that you want to quote. You can only quote up to 3, same as the other way, and they go to the top of the screen instead of on the bottom, but here are the 3 plans that you can do that, and you can then send a quote. The nice thing is you can send it via email or you can send it via text. So you can do both at the same time. You can put in a personal note in here and you go ahead and hit send. I'll get that text way before I get that. Okay. And again, here is the authorization code that is specific to this client for this scope. So you can either write that down, save that for that person, but on the text message itself, this one will have the access code there listed. Here's your quote here. You're going to need that access code. Just remind that person that they're going to need that access code with that. So when you go ahead and view that quote, click on that link, it will open a new page. And again, hi John, please enter the authorization code that was supplied to you. Go ahead and hit continue. And here's your quote. Comes in a nice page. It does go side by side. The person can then go ahead and add their own prescription there, add their own pharmacy information in there. They can see the plan details. They can actually go ahead and start an enrollment if they certainly do want to do that. So that information is there. So if you want to go ahead and compare these plans, go ahead. We're going to hit compare. And it's going to go into another page where it shows the differences between the plans. The nice thing about this is that it will highlight in these yellow boxes, as you can tell, how much your annual cost will be per plan based on how often you see the doctor, how much you have for pharmacy and different things like that. So that's kind of a nice feature of Medicare app where it highlights the differences between the plans so they can see that head to head. If you need to see the plan documents, you can go ahead and hit view details, and then you can go to the summary of benefits, enroll, go through the actual enrollment application in multiple different languages. You can do the provider search, prescriptions, and monthly pharmacies with that. Okay. I'm going to recommend that you not use your back button up here in the upper left, but you hit previous to go back to the quote that you were at. It'll make it a lot easier. If they don't want to include a certain plan within this quote, simple, we just X out of that, and that now it only compares 2 different plans. But going down to the bottom as well, you can do that provider search, prescription directory, and pharmacy based on every that. Janet asked, does it allow you to send quotes for plans I'm not licensed for? Unfortunately, with this, it does not. We can't select that, and I'll go back and I'll show you what that looks like going from that. Okay, but on the quote, the nice thing about the quote is that you can add it to your cart to go ahead and enroll. But we're going to go ahead and we're going to close this out. So if we show these other ones, we can, hold on, get out of here. We can do a comparison. Let me get another. You can do a comparison and do it this way, but you won't be able to send a quote. So it's the same thing where you can show the differences between the plans if you so desire. That way they have that. Unfortunately, you can't do anything else further with this, unless you want to show the doctors, you want to show the pharmacies how much their drug costs are going to be. All that information is there available for you. The problem is you can't do anything further with it because, again, I'm not licensed to sell this. I am, but I'm not. So you can do a comparison, but you can't send that to them to be able to do a quote like we just showed in that aspect, unfortunately. Good question, though. Okay. All right, so based on that, we're gonna go back here. So as you notice on the top, one thing I did skip over. Janet asked, does Medicare app also require searching for one doctor at a time for each carrier? It does, but on the profile, you can put providers in there. Again, go ahead and if we have a provider that I want to do that, I want to make sure I can select one as a do a primary care search. Let's do, I don't want a nurse practitioner. If I add this in there to that profile, we're going to go ahead and hit continue. We'll go to plans. You can do that there too. Okay, here, so essentially, Janet, yes, you can. So here's where it shows your providers 0 of 1 in network. My PCP is out of network. So it does show you that on here if you do select a PCP. So essentially it does, but it's just not in an easy grid to show you that. So if you do have a PCP that is in network that you just select one, it will say one of one in network. And unfortunately, right now, the one that I selected right there is not a primary care provider that is in network. So it does show you that. Nothing there for anyone. Okay. Good question, though. So go ahead. Now, again, we've gone through our quote. We're going through that person isn't necessarily ready to enroll. You can go through that quote and do that. They can enroll themselves, but if we're going to go ahead and enroll in a plan, and we're going to enroll in a different one here, there are two different ways to do this. You can send to the beneficiary to sign and submit, or you can do and submit that yourself with them, especially if they're sitting right there in front of you. You can do that, or they can fill it out and then send it back to you, and you go ahead and submit it in. But for now, we're just going to go complete and submit for yourself. We're going to go ahead and, again, if you need to change the plan or remove the plan, that's one you don't want to do, you made a mistake and clicked on a wrong one, here's your opportunity to change that. We're going to go ahead and apply for this. Now what it's going to show you is that we're going to be redirected to the carrier's enrollment form to complete that. So the nice thing is Medicare app uses Connecture, which a lot of carrier enrollment platforms are now on Connecture as well. So if it's not on Connecture, it just gets rerouted to a different carrier website. So in this information here, you're going to go over and double check everything. Anything in a red asterisk is what you need to put in. For enrollment purposes, I'm going to go ahead and put in some fake information in here to go ahead and enroll in a plan. So anybody that was in attendance on my previous one on the 17th, I got a call from United Healthcare yesterday confirming my application and my enrollment. So it does work. Just a FYI. Got to make sure we select male or female. Phone number, email, address, everything that is correct. They have a separate mailing address, yes or no. Emergency contact, if they want to include one of those, yes or no. We're going to go ahead and hit next. Okay, here's Medicare information. The name as it appears on the card. John L. Smith. Let's see, there's our Medicare number, part effective date here, making sure that we're Medicare eligible based on dates. And then it's going to go into what type of enrollment. Are we new to Medicare? I'm in a Medicare Advantage plan that I've had for less than 3 months. I want to make a change. That's your OEP. If you have questions about that, you can look at, just hover over, you don't have to click on this, but you just hover over that question mark and it tells you what question that is. I just moved outside the service area, different things, but there's a number of different enrollment periods that you have there. For this one, let's see, we're going to select that we're just new to we're new to Medicare, or we're going to utilize, where's my, hard part is they run into each other real close. Where is my coverage from my employer? Okay, so you can select multiple ones of these, but you don't necessarily have to. I left my coverage from my employer union, including COBRA. Make sure that date is correct. That's on there. And then prescription drug coverage. Do you have any other prescription drug coverage? These are for your MA only plans or veterans that get it through TRICARE or the VA. Make sure we select on those. Are we in long-term care, Medicaid enrollment? Does your spouse work? Yes or no? So now I skipped this Medicaid enrollment on purpose. So if I hit next, well, surprisingly it didn't. Typically you have to answer all those questions, but a lot of times, maybe you don't have to for that one. Excuse me, PCP. Again, optional on a PPO. If it's an HMO, you do have to select that for MAPD plans. You can add a physician in here, there, or you can write the ID. If you know the PCP number for your physician, you can add that in there. It's a real simple way of finding that. Just clicking on here, enter the zip code for United Healthcare, 55372. Providers currently in network or providers that are going to be available on 1/1. So there's two different ways to find out what that is based on contracts, making sure you're selecting the correct network going from there. So I'm going to fast forward this, but that's a way that you can add the PCPs in there, going directly through the carrier network. Okay, below that, you're going to select, I want to get a monthly bill, or do I want to have it automatically deducted from Social Security or any other benefit that you have available? I want to get my benefits from Social Security. I prefer for English versus Espanol. Okay, and here's an opportunity for you to review the information with your client, making sure that contact information that is in there is properly added in. The benefits for their Medicare card are properly in there. Your enrollment, using the right enrollment on Medicare app, you can actually now select this question. Oh, whoops. If you need to make a change, my apologies. You have to go ahead, hit edit, and that'll take you back to that page you were at. Okay, and you can then select those buttons there that you missed, or if you want to be able to make any changes, and it's going to take you back to the previous pages where you were in. Skip through it for that. There we go. That's how we want to get information. Go from there. It's important, again, they've read this information as a statement of understanding, that they understand what plan that they are enrolling in, whether it's the beneficiary themselves or power of attorney. Again, if it is a power of attorney, here's where they're going to ask for that information to potentially verify that information with the state. Okay. I understand this beneficiary signature. If they have limitations, they're unable to sign, click on this and then they can type their name. But otherwise, you can just use the mouse and scribble in, or if they're using a tablet, you can just obviously use a stylus or whatever it is to sign that information. Go ahead, and we're going to go ahead and submit. Okay, application submitted. Here's what to expect. Here's a plan that we enrolled in right here, monthly premium. Here's the application details and confirmation. You can view the application here by clicking this. It'll open up a PDF. And then what's next? There's confirmation. And again, at least, got to give it time for that. And then you're good. And yes, that is a live application I just submitted in for my fake self. Okay. And that's everything with that. Hopefully I receive an email soon. Here we go. Okay, so here's what this looks like via email for the scope of appointment. As you can tell, it took a little bit just because of security purposes on our end here at GoldenCare. But here's the information that it looks like for that to complete the scope of appointment. Here's how it was after a completed scope of appointment. And here's the access code for the quote that's in there as well. So I don't think I'm going to be able to get it in enough time to be able to see the process of getting the enrollment confirmation. There's that. So going back to the blue button, here is this through Medicare app. Here's where the person can then log into mymedicare.gov. Clicking on this button, I'll click on this real quick. Janet, I'll get to your question here real quick. but here's where they can log into the mymedicare.gov, log in, then be able to download their drug list for you and that information. Okay, so that's what those look like via email. I don't think. Oh, here we go. This came out. Oh, there again. Here's the quote from Medicare app that just came that we did 15 minutes ago. So again, there's a link right there. They can quote. There's contact information. If they're having trouble with that, they can certainly call you with that information there. For PDPs, Jen, same process for PDP plans. Yes, that is correct. So when you go into PDPs, because I did not cover that before. Again, for here, so for PDPs, it's the same thing. We're adding to the cart. We're just going to skip through this stuff. Say I'm going to take the Silver Script plan, complete and sign myself. It's the same process. It's the same thing. Now it's different with Aetna because this should go to different enrollment. Maybe not. I thought I got redirected a different one. But again, as you can tell, same information that's there based on the profile that you see, and so you can go through the same process with that. Any questions on Medicare app? I know I'm going through this really, really fast. In my experience in the past, Janet's asking how is it different for Aetna? I've had it redirected to Producer World or to Ascend in the online enrollment platform. So if we're doing that, what happened to my desktop? Okay, that was weird. It had gone in previous, they may have corrected that, and now Aetna uses Connecture. But in the previous years, MedicareCENTER had redirected to the carrier enrollment platform. That's all I meant by that. Any other questions? On the bottom, and then I kind of skipped over this. There's a way you can go, do your pharmacy drug finder here. So clicking on this button, and again goes back into, what plan are we going into, and it shows all the plans that you're connected to, but you can't look at other ones on doing this way. And then you're going to go ahead and you're going to find providers, and it's going to go through that search tool again. So that's on the zero med sub plans indicated. Were there? I don't pay attention to that. Oh, because right now, okay, now I understand your question. Because as of right now, they're not, you can't enroll med subs through Medicare app. That's why. Let's just see. No. So if we go through this, so unfortunately, there just aren't any med subs listed on here that I can sell. So if I add non-licensed plans, Will that change? No. It's just MedSups you can't enroll through Medicare app. You can on Medicare Link though. So I don't like to use MedSup on here for Medicare Link because it comes across differently for MedSups because it gives you the plan that's available. You can enroll in these, but it gives you the available riders. And again, depending on Minnesota, if we have basic or extended basic plans, it shows you what those riders are, but it doesn't give you the necessarily specific dollar amount on there. When you're doing your quote, obviously it's based on a couple of different health factors with that. It just looks really, really odd to me not having all that information into one. That's where, again, I'm getting way ahead of myself. That's where this right here, this MedSup right here, this area is a better quoting tool for that because it includes the actual, based on the person's age, gives the actual dollar amount on the riders. And again, I'm getting way ahead of myself with all this information that's in here. But when running quotes on here, it's a lot better for MedSup quotes on CSG. And again, that's in this area right here under Medicare supplement. That's that information there. That's a different way to do that that I've used a lot in the past. I just don't like how this looks and how this reads for the riders on MedSup, so I don't use that very often because it can be very confusing. It does not. Good question. It does not. But actually, Harvey asked, do quotes adjust for pre and post macro rates on MedSup and Medicare Link? It does not. And it actually, I'm gonna go back in here. I don't believe it does here unless they've updated it on CSG as well. Let me go through here quick. Also discount, we'll apply that. And again, so Medicare CSG, and again, sidestepping a little bit for what we're doing today. The only MedSups that you can enroll on here are from Mutual and from Continental Life. That's it. No more. You can't do other MedSups, Lumico, or anything like that. So that's just FYI, and it's going to put that up there. So based on age, though, Harvey, it does, because you shouldn't be able to put the Part B deductible rider on here if it's at age 65, even for age 60, almost age 66. But you can put that on there, but it does. You can select what riders to put on there. So it does account for that. So if I add that in there, you can see where the price automatically adjusts from 177 to 193 based on the cost of that rider. So it does or doesn't do that. You just got to make sure you're not selecting it if you understand how old that person is. Any other questions? Thinking long term, since Medicare app will eventually be talking to CRM, wouldn't it be better to begin automatically? Yes, it will. Absolutely. So Janet's asking, since the CRM portion here will be eventually talking with Medicare app, is it a good idea to start importing those clients into the CRM? Absolutely. So I would do that. Obviously, October 1st is Friday, so up to you if you want to do that during AEP or after AEP. You certainly can, but a good time to do that is once you get into downtime after AEP. You want to relax a little bit and you have a little bit more time, or in the spring, completely up to you what you want to do that. But it does make sense to do that. Um, I could say sooner than later, but to do that, so then when you are ready for those clients, it's going to be a simple click of the button to be able to go from that. Yeah, yes, Harvey, you'll have to go to carrier website to enroll. Specifically, you can still quote off of CSG. You can still quote that information and go through that stuff, but to enroll, yeah. Good question, Janet. Does it work in reverse? Do clients that you create in Medicare app go into a CRM? Not currently, from my understanding, but I could be completely wrong on that once that gets finalized. That's a very good question. Any other questions? Okay, not as of right now. Want to thank everybody for attending. Great questions today. I appreciate the interaction. Just as a reminder, there is a voucher that is available for free CE. Hold on, let me finish my thought here real quick, Raphael, before I get your question. There is a voucher that you can receive a free CE to redeem for free CE. Just look for a link for thank you for attending to get that voucher for free CE if you have that coming up. Like my license expires in January, so I need to get some CE stuff going on. I probably won't do that till after AEP, but you can have that available to you to receive that for that. Okay. Back to my link. Can you get an authorized account? Raphael, are you currently contracted with GoldenCare? Is a question. Do you have any of your lines with? It only needs one. You only need one. Yes, Harvey, you can get a second voucher. It's available for you. Oh, okay. You answered that question at the same time. So yes, you do have an authorized account then, Raphael. All you need to do then is I'll log out and I'll show you how this works. So just click on this register button here, fill in your NPN, your name, email address, phone number, create a password, and hit register. What that will do is prompt for someone at GoldenCare to authorize that, and then you'll have it's not instantaneous, but you will have access through that eventually. Give us. So to answer your question, Janet, yes, they can, but it's on an individual basis. Otherwise, they're going to be utilizing if you're okay them using your account, that's up to you. But it can be individual if they are a contracted agent. So there's no admin access. They would have to use your account for that. Good. Any other questions? You guys are great. suppose I could open everybody's mic. Here, I'll open everybody's mic. Now, you may have to unmute yourself in order to speak freely, but go ahead if you so desire. If you want to ask me any live questions, I could have done that a long time ago. My apologies. There we go. I'll do it this way. You don't have a mic, Janet. Come on, we talk on the phone. Just kidding. Very true. Harvey, I opened your mic. You can speak freely if you have that available. Raphael, I did yours too. There we go. Now I hear people. Vern.
My microphone works, John.
Okay, I hear that. I can hear that now. Too funny. Janet, we got to get you up.
You're more than welcome to use my microphone if you need to.
No, I could have, instead of waiting for you guys to type in your questions, I could have easily had open mic access. So
next class.
Next class. Yeah, next time I do this next year or in the spring with the new changes and everything that's going to happen, I'll have another one there. But this in itself, Harvey, this is crazy information that's in CSG. Just unbelievable how many. So you saw all the options that are available in here.
Mm-hmm.
So go back. I'll click on this.
If we want to be appointed for Continental, those are the two supplements you have, Continental and Omaha, I think. If we want to
well, no, that's only. Hold on, let me. That's only for
Medicare Link.
Medicare, no, for CSG. So getting, I'll get back into CSG here. So the only thing, all of this stuff is available to you. Final expense, hospital indemnity, all that long-term care stuff. All that stuff is in here that's available on this. It's a completely different animal. And going through this would be another 90-minute presentation going through all this fun stuff. There should be recorded webinars on CSG available to you on our website. If you look at previous, if you go to GoldenCareAgent.com and look at training and previous training, it should be there as far as Anna Patrick from CSG going through all this fun stuff and what's available.
What is
and how
that
it
website
goes.
again, John?
GoldenCareAgent.com. Yep. So we go to GoldenCareAgent.com. I'll show you this. This is, so if you go to CSG under tools, you have access to that. Of course, there's all this fun stuff. There should be.
The answer should be obvious.
Here we go. So here's so at the very bottom under CSG, click for a pre-recorded demonstration of actuarial. So that's what that is Anna Patrick from CSG going through all the different tools that are available right here.
So is CSG what GoldenCare, like an upline for GoldenCare, or what's the connection?
Well, so CSG is now owned by Integrity Marketing. So it used to be where all GoldenCare agents had free access to CSG as well, but Integrity Marketing ended up buying it and put it under their name. So anybody that has a contract with Integrity Marketing now has access to CSG.
Okay, so if we want to be appointed with a company that we're not appointed with, do we have to go through existing uplines or other general agents first in order to get appointed through you, or
is
that our call?
So it's completely up to you. So if you have an upline, so you want to move all of your carriers underneath GoldenCare. So there's a lot of times a cutoff date for that to be able to get switched over.
Mm-hmm.
Like an exception, like with Janet, we were able to get Janet underneath us for Medica after the cutoff date because we begged and plead with Medica
And
to
it's
get that
Janet,
done.
after all. You know, that's enough
Well,
reason right there.
I mean, hey, she wanted to move her stuff, and we said, heck yeah, we'll try and make it happen. But sometimes we can't. A lot of times you need a release from your current
Okay.
FMO or whoever you're underneath. If you're under a different upline, so if you say, Harvey, you worked for me, and then you and Raphael are underneath me, and you want to get a specific line. Theoretically, the way that works is that I would need to get that license appointed first, my license appointed first, and then you would be able to have that underneath me.
Got it.
Does that answer your question, or are you talking about more of the release aspect from the FMO?
Right. No, that makes a lot of sense. I'm
Yeah.
trying to fill in the holes of where the network connections are.
Yeah.
To
Yep.
understand how this all
Yep.
works.
So that works. So that's where if you have a different FMO for UCare or Blue Cross or whatever one you want to have that underneath GoldenCare, we may have to just do that in the spring.
John, thank you for offering this again.
You're welcome.
Picked
90
up
minutes.
additional tidbits. That was really helpful.
Yeah, you're welcome. And I know I went through more stuff today than I did a week and a half ago, but that's okay.
That's all right. We've gotten used to drinking from a fire hose. We don't mind getting wet anymore.
I know sometimes I have to apologize so many times for going over this so quickly because there's so much information that I'm trying to do it in an allotted amount of time for me, so my day doesn't get away, but also doesn't take away from other things that everyone else needs to get through in their day. I mean, your Tuesdays may not be as busy as mine per se, or you may be more busy and you need to bail out, and that's completely fine.
We're happy to compete with you.
Yeah. I appreciate the time, and I enjoy doing this part. So.
Okay, my friend. Thank you so very much.
You're very welcome, Harvey. Yep. Thank you, everybody, for attending. And if you do want that second voucher, you can get that second voucher. Just go ahead and redeem it. I mean, might as well, right? So. Other than that, thanks everybody for attending. I appreciate the time, and have a great day. If you have any questions, call me, email me anytime. I'm happy to go over this stuff individually. Guys, have a great day.
Check out our website, goldencareagent.com, or give us a call at 800-842-7799.